As team physician for the New York Yankees and providing care for our professional baseball players, it's clear that we have a problem with increasing number of elbow injuries at the professional level. These elbow injuries often result in the need for Tommy John surgery. We're seeing, in fact, what is now an epidemic in elbow injuries. It disrupts the playing careers of our professional athletes. However, it's our younger athlete, it's the youth athlete, the high school baseball pitcher, who is at real risk for interruption of their dreams of playing continued baseball and even going on to higher levels. In fact, it's the youth athlete that is at most risk for sustaining an elbow injury. It's the population that is growing the fastest for need of Tommy John surgery. It's this population that we should focus our injury prevention, attention, and efforts. I'm part of a Pitch Smart program developed by Major League Baseball that has taken a group of specialists together, myself, others, looking into the reasons why there's risk for Tommy John surgery and creating methods to limit or reduce that risk, thereby reducing the injuries and the need for Tommy John surgery, not just in the professional athlete, but also in the youth athlete. If we understand the risk associated with injury to the elbow, then we can start to develop prevention strategies, modify those risks, and reduce the injury and hopefully reduce the amount of surgery on these young athletes. So the first thing to understand is the ligament that resists stress to the elbow during throwing is a small ligament. It's in fact fairly fragile. Work in our laboratory has demonstrated that the failure strength, meaning how strong is the ligament, is actually weaker than what is involved with throwing. The stress of throwing almost always exceeds what the failure strength of the ligament is. So what that means is with every pitch, there's risk of doing harm to the ligament. The first risk factor that deserves attention is the amount of throwing volume in our young athletes. Our young athletes are specializing. They're playing year-round baseball, playing on multiple teams. They're throwing large number of innings at each time that they're on the mound. What this results in is an accumulation of throwing that is stressful to the ligament of their elbow and injures the ligament of their elbow. More and more now we're seeing young athletes come into the office. In fact, when I see patients, oftentimes my exam rooms are filled with young athletes and their parents with elbow pain. The amount of injuries to our young athletes is increasing at epidemic proportions, and the injuries are now often severe, with ligament injuries, with tears of the ligament that now require surgery. We've been conducting research here, and it's showing through ultrasound evaluations of the ligament that there's changes that occur at an early age, that the ligament is actually changing. It's getting thicker, it's under chronic stress, and there's calcification forming. A major concern for our young athletes is throwing with fatigue. Fatigue is a problem because it will increase the stress on the elbow. Throwing requires energy, and that energy comes from the legs and the trunk. With fatigue, they tire the legs and the trunk, thereby not contributing to the energy involved with high-level throwing. Athletes who are throwing with fatigue, they will try to compensate by moving their upper body harder. That increases the stress on their ligament. So throwing with fatigue is one of the biggest factors for sustaining an elbow injury. How do we avoid fatigue? We need to monitor fatigue. One way is to monitor pitch counts, and not just pitch counts, but also the amount of maximal effort throwing. That is, how many pitches are they throwing at max effort? In addition, we need to monitor recovery. So after hard throwing, there has to be an adequate recovery time so that they are not fatigued the next time they go out to throw.